That question is not in order. I call the member for Deakin.
Thank you, Madam Speaker. My question is to the Minister for Health. Will the minister tell the House how many of my constituents who have registered their details on the personally controlled electronic health record system would be able to have their records accessed if they presented at Maroondah Hospital in my electorate of Deakin?
I call the honourable Minister for Health.
Thank you very much, Madam Speaker, and thank you to the member for Deakin. It's great to have a great member back in Deakin. He's a good man. He's working hard for his electorate already. He is very, very concerned about the health needs of the constituents in his electorate, and I knew that he had an interest in this electronic health record, or the PECA as it's known. And I knew, Madam Speaker, that we should try and answer this question in a meaningful way. So I said to my department, let's work out on a percentage basis how many of his constituents, how many of those constituents can turn up to an emergency department and have their electronic health record accessed on the computer system there. So the first thing, of course, was to establish how many people in his electorate, 126,672, according to the latest census. But there was a problem. There was a big problem, Madam Speaker. The department said, Minister, we cannot provide you with a percentage figure. And I said, well, surely it's easy. We now know the population. We want to know how many people can access the computer system in the public hospital when they turn up. Not a big ask, I didn't think. So I said to the department, please, we've got to work harder on this. They said, Minister, it can't be done. It can't be done. And I said, well, let's apply more resources to it. So in any case, they came back to me and said, Minister, the reason that it can't be done is that the former government forgot to talk to the hospitals or the doctors about how these systems should work in the public hospital. So the answer, of course, is that zero. Not one of those 126,000 people who might turn up to the local public hospital in the member for Deakin's electorate can get their record accessed on the computer system within that hospital. Now, the level of incompetence knows no bounds when it comes to the health portfolio during the time of the previous Labor government. And the previous minister looks bewildered. She looks bewildered and befuddled, but it's true, Tanya. It's true. You forgot to talk to the doctors in the hospitals.
The manager of opposition business will resume his seat, and the minister will refer to people by their correct titles.
Of course, Madam Speaker, I say to the member for Sydney, who looks befuddled and bewildered, it is true. It's true. You didn't talk to the doctors.
I did ask the minister to refer to. OK, fine. Point of order from the manager. Minister will resume his seat. What is the point of order?
This minister has gone further away from direct relevance than anyone else on that front bench. Anyone else. And the point of order I wanted to take earlier was not only about referring to people by their titles, but what he is talking about is completely irrelevant to the question that he's asked, and he should be brought back into line.
I call the honourable Minister for Health and remind him to address the question before the chair.
Thank you very much, Madam Speaker. Well, to try and provide some enlightenment to the former minister, I just leave her with these facts. They announced the personally controlled electronic health record 3.5 years ago. 18 months ago, the former minister jumped up and said that the system was going live, that this was a great time for our country. Do you know that $1 billion was spent by the previous government, and $1 billion, and get this, 10,000 Australians of 23 million have a record on which a doctor has uploaded a summary of their health information. So just do the math for a second, because this works out to $100,000 per patient. Now there is shock on this side, but by that side's standard, not a bad outcome, I suspect.